The hearing of the Senate Blue Ribbon Committee is hereby called to order, together with the hearing of the Committee on Health. Good morning, everyone. Let's start off with acknowledging the resource persons who are here today. First off, thank you very much for coming. Attorney Nick Lutero of the Health Facilities Services Regulatory Bureau of the Department of Health.
Morning, sir.
Dr. Dominga Padilla.
Good morning.
From the PhilHealth, the President and CEO, Alex Padilla.
Good morning po.
The Vice President of the Arbitration Office, Alfredo Pineda.
Good morning, pa.
Is your nickname Dodi? The man of the hour, Internal Audit, Dr. Robert So.
Morning, sir.
The newly installed chairperson of the Committee on Appealed Cases, or CAAC, as they call it, Ms. Ana Teresia Ontiveros Barakel.
Magandang umaga po, Mr. Chairman.
Good morning.
Good morning, sir.
The Vice Chairperson of the CAAC, Dr. Francisco Vicente Lopez.
Morning, sir.
Morning. Member of the CAAC, Dr. Alexander Aiko.
Good morning, sir.
Good morning. Ms. Jane Santa Ana, member of the CAAC.
Magandang umaga po.
Good morning. And member of the Fact-Finding, Investigation, and Enforcement Department, Sibel Estrada.
Good morning, sir.
Good morning. And Mr. Claire Malyari
Good morning, sir.
of the Fact-Finding, Investigation, and Enforcement Department. Good morning. The Chairman of the Board of Medicine of the PRC, Dr. Miguel Noche.
Good morning,
Good morning.
Your Honor.
Morning. Pacific Eye Institute, Dr. Gosing Fiao.
Good morning po.
Good morning. Dr. Barasi,
Morning, Your Honor.
Dr. Brian Ongkiangkop,
Good morning, Your Honor.
Dr. Silvino Cabrera III.
Good morning, Your Honor.
Morning. Quezon City Eye Center, Dr. Raymond Evangelista,
Good morning, Your Honor.
Dr. Ramon Fontanilla.
Good morning po.
Finally,
Your
you're
Honor,
able to
Your
come.
Honor.
Okay, thank you. Dr. Alan Valdez,
Good morning, Your Honor.
Dr. Joselito Castro.
Good morning, Your Honor.
Morning. Borough Medical Care Institute, Dr. Azalea Heredia.
Good morning, Your Honor.
Good morning. Mr. Sergio Araneta.
Good morning, sir.
Yes, good morning. Of course, nandito rin po si Mang Romy na nag-testify daw nung nag-testify last hearing, no, tungkol sa nakakalungkot na pangyayari sa kanya. Magandang umaga po, Mang Romy.
Magandang umaga po, Your Honor.
And representing the Philippine Alliance of Patient Organization, Philippine Alliance of Patient Organization, Ms. Fatima Lorenzo.
Good morning, sir.
Good morning. Okay, in the last hearing, we took up the plight of some of the people who have been allegedly have been victimized by the so-called illegal practices of certain eye clinics. And we also talked about the cases. We also talked about the cases pending with the PhilHealth, and we also touched on the issue of the of patients' rights. That's why we have invited a organization today called the Philippine Alliance of Patient Organization. So actually, there are three pillars that we see here. First, the professionals. Second, the institutions. And third, the patients. Before we proceed, let's just have an administrative matter. Let's dispose of this. All those who are here na hindi pa nakapag-oath, please stand up. The Director General is directed to administer the oath.
Raise your right hand, please. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth in this proceeding? Thank you. You may take your seats.
Okay. Attorney Lutero, you have a request that you be allowed to leave early before.
Yes, Your Honor.
Okay. Attorney Lutero, since you have a request, let's tackle your issue first. Yes. No. Some institutes have been already mentioned in the internal audit. Some eye institutes. Some of them are here: the Quezon City Eye Center, Burroughs, the Pacific Eye Center. Have you already inspected these facilities?
Well, they have been monitored, Your Honor, and they are still found to be compliant with our licensing.
What was the extent of your monitoring?
We have our standards, and based on their facility, the medical personnel that they have, and the equipment in their clinics, they're found to be compliant with our requirements, Your Honor.
How many institutes have you monitored?
Not all, because we have around 38 more or so clinics specifically dealing with eye problems, Your Honor.
How many have you already monitored,
I think
inspected?
we have monitored about 5, Your Honor, in the meantime.
5?
Yes, Your Honor.
When did you do it? When did you inspect them?
Even before this issue came up, Your Honor.
Even before these issues came up?
Yes, sir.
What prompted you to inspect them?
Yes, they're part of our monitoring, regular monitoring activity.
Yes, but why them? What prompted you?
Well, their proximity to Manila, Your Honor, it's easier for us to monitor them than before we spread out to the provinces because of our limited resources.
No. I'm talking about, for example, let's pick Quezon City Eye Center. Have you already inspected Quezon City Eye Center?
I think so, sir. We have done.
You think so?
Yes, sir.
Can you be certain?
I will check and get back to you right away. My point is, how come you inspected these institutions? You're telling me just because they're nearer Metro Manila? Or was it something else? Your Honor, it's part of our regular monitoring and licensing activities, Your Honor.
How can it be regular? When in the last hearing, you told us after licensing, may problema kayo sa monitoring. Tapos ngayon, sinasabi mo, may regular monitoring kayo.
Yes, Your Honor.
Give me your inspection reports.
We will do that, sir.
I suppose they're written, or are they verbal?
Yes, we have written reports, sir.
You have?
Yes, sir.
How can they be regularly monitored? In the last hearing, you just admitted that your bureau has a problem in monitoring. And now you're telling me you can regularly monitor them?
Well, Your Honor, I'm sorry, Your Honor, but we do monitor them. Maybe not on a very regular basis, Your Honor, but we do monitor them.
My point being, let's acknowledge the presence of the Secretary of Health, Dr. Janet Garin. Good morning, ma'am.
My point being that it has come to our attention, Secretary Garin, that in the past, and I would like to emphasize in the past, that Department of Health and PhilHealth do not walk in tandem. Sometimes what PhilHealth does is not also followed up by the Department of Health. Now, yes, you can blacklist, PhilHealth can blacklist the facilities. Am I right, Attorney Padilla? In terms of payment.
Suspend payment.
Suspend payment. To be more exact, using more exact language, suspend payments. But the license to operate is lodged with the Department of Health and can only be taken away by the Department of Health. Am I correct, Secretary Garin?
Sir, actually, we had a meeting yesterday, and I discussed this with Attorney Nick Lutero and inquired why this happened. Apparently, there was a change in procedure, and that any facility accredited by the Department of Health is deemed accredited for PhilHealth. Am I right? That's yeah. It's some sort of an automatic accreditation, and this is something that we intend to. I've actually conveyed it already to to Attorney Nick Lutero and the other hospital chiefs of DOH hospitals. Got their input. We also got in touch with a representative from the Philippine Hospital Association, and this will be part of the changes that we will be implementing in the next 2 weeks.
What will the changes be, Secretary Garin?
While DOH will be tasked with accrediting health facilities on the license, on basis of issuing licenses, PhilHealth will have its own power of suspending, revoking the PhilHealth accreditation of any healthcare facility.
That's exactly what we'd like to look into now. I think you should address that, because why will you have someone an institution whose payments, the right to claim payments have been suspended, continue operating as a hospital? If there is a final decision, I would like to emphasize a final decision on the matter of the institute, then don't you think PhilHealth should walk in tandem? Because if they've been found guilty of fraud, for example, and then you still continue giving them the license to operate, is there not something wrong there, Secretary Garin?
We fully understand, sir, and that's basically the reason why we have had several meetings with President Padilla, and I've discussed this with Attorney Lutero last night, and we are in the process of taking note of all these inputs, Your Honor.
Yes, for example, just now, we're talking about several institutions that have already been mentioned in the internal audit of the PhilHealth, and yet they have not been monitored. Just now, I asked Attorney Lutero if they have been monitored. What was the basis? The basis, I was presupposing that the basis would have been these hearings, because he has been present in these hearings, and the internal audit of the PhilHealth has been made public, and yet his answer was the basis was proximity to Metro Manila. He just said so. So it doesn't seem that PhilHealth and Department of Health are not in tandem.
Yes, sir. We keep note of that, and we assure you that in the next 2 weeks, once the Board of PhilHealth meets, then we will do the necessary, and the Department of Health will respect the mandate of PhilHealth in terms of accrediting healthcare facilities.
But my point being that PhilHealth and Department of Health must walk in tandem, must talk together, and must act as one. It cannot be like this na there are already hearings, there is already notice to the world that these institutions, that there are red flags, let's call it red flags, for that on these institutions, and yet they were not monitored. Or the basis for monitoring them was the proximity to Metro Manila. What was that? Attorney Lutero, I do distinctly remember in the last hearing, I wanted you to submit a list of personnel and whatever you need. We're coming up with a budget hearing soon. And you will be facing me again in the budget hearing. Sasabihin mo na naman kulang. Wala ka pang sinasubmit o may sinubmit ka na. Am I?
We will submit it today.
Ah, you will. Okay. Secretary Garin, please be put on notice that I think you have to pay special attention to your monitoring group for facilities in the Department of Health. In the last hearing, Attorney Lutero distinctly stated that after the licenses have been issued, may problema sila sa monitoring. How many people have to go blind before we actually start monitor an honest to goodness nationwide? Nationwide, wag lang yung proximity to Metro Manila. Bakit? Yung mga tiga Mindanao, hindi ba dapat bigyan ng sapat na atensyon tungkol sa kalusugan? Hindi po pwede yan. Ilan pang dapat mabulag para magkaroon tayo ng proper monitoring sa mga facilities na sa mga ospital, sa mga eye clinics, at iba-iba pa.
Sir, we took note of this. In fact, when my attention was called by your office, I've had discussions with Attorney Lutero, and we realized that his obligations was extended so much. He was concurrently the Chief Legal Officer of the Department of Health, and he was also concurrently the Director General of the Food and Drug Administration. After conferring with him and taking note that the Bureau of Health Facilities actually holds a very vital position and the task is so extensive, I have decided to put a core team to manage FDA and myself overseeing it. And the legal office is already handled by an OIC, Attorney Mela De Vera. So Attorney Nick Lutero is now tasked to just handling health facilities. We have been fully supporting them insofar as logistics is concerned, going around the country. And allow me, Your Honor, to apologize in behalf of the department in overseeing the complaint, insofar as delaying the action on the complaint of another center in Zamboanga. I was not party that there was voluminous documents going to the Senate, to PhilHealth, and to the department. And we also have conveyed this. Yes, we do admit that our attention should also focus not in Metro Manila, but also in Mindanao. And rest assured that I have already called the attention of PhilHealth. We will be acting on an institution that was pointed in Zamboanga. Thank you, Your Honor.
Yes. Pero ang pinakapunto ko rito, no, dalawa. Number one, yung capacity ng, what do you call your department? Bureau. Bureau of, Attorney Lutero, what do you call it?
Health Facilities.
Bureau of Health Facilities.
And Services. Regulatory
Yung capacity ng Bureau of Health Facilities to carry out its mandate. We can take that up in the budget hearing, which is the proper forum for that. But submit it in advance. You did say last hearing you would submit it, and you haven't submitted it yet, Attorney Lutero.
Yes.
Okay. And second, which is more important, which is also equally as important, that PhilHealth and the Department of Health walk in tandem. If there is a red flag already shown by PhilHealth, I think Department of Health should also take action, motu proprio. Not in terms of prosecuting, but finding out that there is a red flag of this facility, then go there, check, because the licensing and compliance with the requirements of continuing operating is lodged with the Department of Health. Are we clear?
Yes, Your Honor.
Thank you. Okay. Let's move on to PhilHealth. The members of the CAAC are here present, I understand. Yes, they are. Okay. Ms. Ontiveros Barakel, how long have you been chairman?
Mr. Chairman, in the recent board meeting of June 2015, we reorganized our board committees. And it was during that meeting na ako po yung naging tagapangulo ng CAAC ng PhilHealth.
Kailan po? Anong month?
Ito pong nakaraang buwan ng Hunyo 2015, Your Honor.
Okay, so bagong-bago lang po.
Yes po.
Okay.
Pero naging miyembro po ako ng CAAC mula November 2014, kung kailan po ako in-appoint bilang board member ng PhilHealth representing health service providers, Your Honor.
Okay. Now, before we take up, in the last hearing, we requested a list of cases appealed to the CAAC. Ang sistema ganito, no? Pag merong complaint, para sa kaalaman ng lahat, pag merong complaint, magkakaroon ng fact-finding investigation body na mag-investigate sa kanila. In fact, yung ibang member nandito. Then yung findings ng fact-finding, kung positibo, iakyat ngayon sa arbitration. Yung arbitration ngayon will decide on the case. And, well, if it's dismissed, then it's dismissed. But if they have found to be guilty of the misconduct alleged, then it goes up to CAAC. CAAC is the appeals board. CAAC is a subcommittee of the board that is tasked with handling the appeals from the arbitration committee. Am I correct?
With just one addition, Your Honor, pagkagaling po ng complaint laban sa isang healthcare professional o healthcare provider, tama po kayo, ang fact-finding investigation and enforcement division ang unang aalam, and then ipapasa po muna nila sa prosecution na maghahanda po ng kaso. Mula po sa prosecution, ibibigay po sa arbitration office namin na magdidesisyon dun sa kaso. Kapag po nag-appeal yung health service provider or professional, saka po aakyat sa CAAC. And then we will decide whether we agree or disagree with the decision of arbitration. Kapag po inakyat pa po namin to board po for final approval, saka po babalik sa arbitration para sa issuance ng writ of execution, Your Honor.
Okay, so dinagdag mo lang yung prosecution.
Yes, Your Honor.
Okay. Fact-finding, prosecution, arbitration, CAAC, board. Board, and then back to arbitration. And then, after that, the entity has the option of going up to the Court of Appeals.
Labas na po sa PhilHealth po, Your
Obviously.
Honor. Pero yes,
Obviously.
yun po yung
Obviously.
proseso lamang namin.
Tignan nyo yung proseso, ha? Mahaba yung proseso. Mahaba yung proseso. Gusto kong ipaalam sa lahat. Ha? From a complaint. Okay? From a complaint. Nandito si Mang Romy, nakikinig. Isang biktima. Oh. From a complaint. Pupunta sa fact-finding. Pagkatapos ng fact-finding, hindi lahat yan. It will take time, no? It will take days. Fact-finding, mag-iimbestiga pa. From fact-finding, pupunta sa prosecution. From prosecution, pupunta sa arbitration. From arbitration, pupunta sa CAAC. From CAAC, pupunta sa board. From the board, pabalik sa arbitration para sa decision, sa execution ng decision. And then, merong Court of Appeals. then of course, meron Supreme Court pa. Okay? Now, let me start off with Attorney Padilla and members of the CAAC board. No? I would like to express my extreme displeasure in what has happened. It's been more than 2 weeks. It's been around 2 weeks, more or less, since I asked for the list of cases. And it's here. I have it, submitted by you. Okay? But you know, I really have a very, very bad feeling about this because it's been 2 weeks. It's a simple list, as you can see, as you have submitted. And you did not submit it ahead of time. What were you looking at? I only received it yesterday at 5 o'clock in the afternoon, before the hearing today. Alam mo, ang dapat dito, kung reasonable kayo, dapat binigay nyo sa akin in advance para naman mapag-aralan at makagawa kami ng proper questions. Pero nangyari, last minute, parang time on target ang ginawa ninyo. Yan ang feeling ko. It gives me a very bad feeling. So ano bang nandito na dapat last minute kayo nagbibigay? Bakit kaya?
Yeah, Mr. Chair, I wish to apologize no na in fact tinawagan pa niyo ako no. Kahapon
I didn't want to bring that up, but yes, I'm sorry. Let me interrupt. But I did even have to follow it up with you.
I know, kaya nga ho. And I followed it up rin naman ho. I apologize for that may na-delay ho. But I assure you, wala hong hidden intention of bringing it to you at the very last minute alone. Ano? Tapos, yun na, I had to rely on the records rin na sinabit ho. So, that's the only way of how I can explain it and apologize to you, Mr. Chair, dito sa pagbigay ng late ng ano.
Okay, but I hope this will not be repeated again. And I hope we take this proceeding seriously. Secretary Garin, Attorney Lutero promised to submit something, and now here we are 2 weeks later, and he said he will. It's still future tense. Anyway, Attorney Padilla, I have full respect for your integrity, sir. So we'll take it at that. But sana naman.
Hindi na ho mauulit.
Oh, napuyat kami kagabi dahil kailangan pag-aralan pa namin. Thank you.
Apologize again.
Okay, we looked at the cases of the CAAC that's pending. You have 82 cases, okay? 82 cases. Now, what struck us was napakatagal na mga kaso. Tignan natin ito. Can we show the PowerPoint, please? Ilaw, pakipatay lang please ng ilaw. Okay, sample cases. Sample lang to. Sige, first slide. Oh, putol yung slide mo. Okay. Yung una, tignan nyo, yung Bacolod, Our Lady of Mercy, putol yung kabila. Dito na lang. Specialty Hospital. Yung decision ng arbitration, yung kila arbitration office, was July 2010. Okay? Wala dyan, but it was agended January 21, 2011. Okay? It was received by the CORSEC. Ang reckoning namin yung CORSEC. Kasi yung CORSEC, yun ang secretary ng CAAC. 4 years and 8 months na yan. Ha? 2010. 2010. Doon na ano si Presidente Noynoy. That's when he won the elections. Ngayon, patapos na yung termino niya. 2010. 4 years, 8 months. Boro Medical Care Institute. Third offense. Third offense na yan, ha? And by the way, this is not saying that they are guilty. No, no. This is not, please be assured that this is not showing any culpability on your part. We're just reviewing the length of time. 4 years, 4 months. Received ng CORSEC, 2011. 4 years. Next slide, please. Quezon City I, third offense. Received by the CORSEC, which is CAAC. When is that? Yeah, that's May. May 21. 2 years, 2 months. Second offense. Okay? Next slide, please.
Your Honor, if I may, can we go back to the previous
Let's
slide?
finish it first.
Okay.
Let's finish it first. I'm sure you could explain, you want to explain, or whatever, but let's finish it first.
I just wanted to clarify the first slide, sir. The first slide, please.
First slide. Okay,
yes.
okay.
My apologies for this, but I also realized that for the Bacolod Our Lady of Mercy Specialty Hospital, I was not yet with the Department of Health, Your Honor. I was still with Congress. I don't know if you remember during the mid-2000, this was already a subject of investigation, and it was not a case in 2010. It was in the late 90s. I think I was still a member of the board of the province of Iloilo at that time, and we had many patients who complained. So I will personally look into this, because as far as I'm concerned, we have submitted the documents pointing out to the documentation of how fraud was intercepted and how that document instead became a Bible of other centers to follow.
So you're saying this was even before. Okay, I am relying on the submission of PhilHealth. I suppose these figures are made up, or are they factual?
Your Honor, I don't know about the 1990. PhilHealth was in 1995.
Okay, then.
So this may possibly have been a Medicare case previously.
Okay, that explains it.
Yeah.
Medicare, then.
No, Your
Okay.
Honor. It was during my first term in Congress that I had this investigated. But we will deal with that because that's internal. And I do apologize because I thought all the while that this was already stopped in the province of, in Region 6, Your Honor.
Well, thank you for that, Secretary Green. All the more then, members of the CAAC, you're all here. All the more then, kailangan husgahan ninyo to. Antayin, sandali lang po. I know you want to say something, but let's finish the presentation. And anyway, ma'am, I know you're bagong ano ka lang, so I'm sure you're raring to show your capabilities, which I'm very much aware of, ma'am. I just want to show how it has been. Englewood Hospital. Tignan mo, 7th offense na yan. 7th offense. 2 years and 8 months. 7th? How many more do we need before we take action? Health Serve Los Baños Incorporated, 4 years and 11 months. 12 offense. Ilan pa ba? Bago gumalaw tayo. Next slide, please. Maramag Medical Clinic, first offense, 6 years. Tignan nyo, 6 years na yan. Six years. Sinabi ko nga, patapos na nga ang termino ni Presidente Aquino eh. Ilan ba presidente kailangan dumaan para matapos ito? De Los Santos Medical Center, 6 years and 3 months. Next. Bulyeser Medical Center. 2009 pa yan. Ayan, wala pa si Presidente Noynoy, oh. 2009. 5 years and 5 months. 5 years and 5 months. What is happening to you? Now, next slide, please. There's a discrepancy. CAAC, you submitted 82 cases. In the arbitration office, the arbitration office submitted to us 100 cases. I just want to find out, why is there a discrepancy of 18 cases? Okay. Next slide, please. What are the meetings held by CAAC? 2010, 5 meetings. 2011, 9 meetings. 2012, 14 meetings. 2013, 11 meetings. 2014, 7 meetings. And 2015, 2 meetings. I can understand. Dr. Aiko,
Yes, Your Honor.
you were the vice chairman at that time, and we all know that the chairman, the late Honorable Secretary Senator Dr. Flavier, was very sickly. He would attend for a while and then leave because of his physical conditions. And from 2014, the agenda shows that you were the one chairing the CAAC.
Second half of 2014.
What happened? Why like this?
Your Honor, can I explain?
Yes, please.
Okay.
That's why I'm calling
Yeah,
you.
Yeah. Thank you, Your Honor. This is how it started in CAAC, sir. I entered 2011. All the cases were presented without the arbiter would present the cases to us. And then we're supposed to review it, but all the cases after presentation by the arbiter was just signed and sent up to the board. What we noticed, sir, is that during the time in 2011...
Dr. Aiko, I have to interrupt you because what you're saying is not factual.
No.
It was
Yes.
the submission of CAAC says here, all the cases are for drafting of resolution to the
Yes,
board.
sir.
That is sent to the resolution, the final decision is sent to the board for confirmation.
Sir.
In fact, it says here, CAAC recommended penalty in all the cases, in all 82.
Yes.
Now, my question is, where is this recommendation found? What document? Dr. Aiko, I'm asking you, you were the vice chair of the board. What document were they found?
What do you mean by what document, sir?
Was the
penalties?
The recommendation of the penalty.
The recommendation of the penalties for this, sir, started, this was the...
No. Where are they found? What document are they found?
In the IRR and...
No. Each case has a recommendation penalty.
Yes, sir.
As submitted by CAAC. Where are they found? Is this verbal?
It's in the minutes, sir.
It's in the minutes.
Yes, sir.
Which you conveniently did not submit. May I be favored with the minutes in a couple of days? By Tuesday next week, would that be possible, Attorney Padilla?
Yes.
We will ask...
And I think, sir...
Well, sandali lang po. Attorney Padilla?
Yes.
So that's a yes, ha? Okay. They were found, kasi nakakagulat na lahat ng ganito, ang tagal-tagal ng kaso, pero merong recommendation na for penalty. Go ahead, Attorney Aiko. Dr. Aiko.
Sir, can I give a brief background regarding these 82 cases that we submitted to you?
These are all the cases that
Yes.
are pending with you.
Yes, sir.
And, you know,
Yes, sir.
if...
No, because
Sige, go ahead. Be brief. You said brief. Go ahead.
Because CAAC receives cases of single cases and multiple cases. During the time when we entered in 2011, there were no guidelines for CAAC on how to follow anything. So what we did, sir, actually, in 2011, we were deciding cases in 2000 or 2001 or 2003, for your information of the Senate. So it bothered us, why are we still deciding on cases in the year 2000 or 2001 or 2003 in 2011? That was the question we asked the arbitration department. Second, sir, we are not lawyers. We would read each individual cases. We would ask, what were the circumstances? What are the nearest hospital these particular cases involved? There was no matrix whatsoever, sir. So in 2011, one reform that CAAC did was we had a matrix. What will the matrix help? It will help us whether this case is a first case, second case, or a third case. Because I think the decision for the penalty would be dependent on this, sir. And actually, those recommendations were presented in our new IRR. Because there was never any procedure regarding this. So during this whole time, sir, we were all doing all the cases, single cases. What happened with the multiple cases? There were different problems regarding the multiple cases. I believe Attorney Padilla, who was the chief operating officer during that time, even presented to CAAC the gradation of penalties regarding multiple cases. Because we cannot agree, arbitration and PROSEC cannot agree whether it is a one case or a several case thing. We are not lawyers, so we ask PROSEC, we ask the legal department to help us. We never had, to tell you frankly, sir, yes, if you look at this end stage, this is the end stage of what we have, sir. If you look at it from all the cases we reviewed when I sat down in 2011, we are current regarding the cases brought to CAAC. So, my point, there was no guideline whatsoever for CAAC to decide. So I think the appeals were dependent. We had to study it, sir. And in fairness to Senator Flavier, yes, he would, but I think he was still intelligent and sharp. He helped us a lot, sir. He gave all the necessary information for us. Yes, he was rushing sometimes, but he would give the best intelligent information for us to decide.
First of all, Dr. Aiko, let's not pass the buck.
No, I'm not passing the buck.
Let me finish.
Sorry, sir. Sorry.
Dr. Flavier, I know, has been very sick. In fact, he had a hard time talking. In fact, I have info that he just attended the meeting and then after a few minutes left. The Director General of the Blue Ribbon Committee is Attorney Kimbo, who used to be the Chief of Staff of the Secretary Flavier, and he's been in constant touch with him since all the way. So I did consult him already this morning, and he did verify that fact. Now, you made an explanation. Fine. Pero may diferensya ang explanation at justification. Does it explain? Yes, maybe, but it does not justify. Still, whatever it is, Now, you're saying hindi kayo abogado. Then, Attorney Padilla, Secretary Garin, maybe it is ripe for a new piece of legislation to change the composition of the board. Because according to them, they are not lawyers. Is that what it takes? I don't know. I don't know. But the point being is whatever it is, hindi pwedeng ganito. This is not justifiable.
Sir, apologies for that in behalf of the department and PhilHealth again. Yes, we do agree that it is not an excuse, because if you take on a position, accepting the position, responsibility comes with it. And it can never be an excuse that you are not qualified to do so, because you should have handed down that position to somebody who will understand the ins and outs of handling appealed administrative cases. But with that, Your Honor, we have, I also know that, as I have been conferring with President Padilla a few minutes ago, just to inform you, in all the EXECO meetings of the Department of Health, we have already involved PhilHealth. They have been involved, but unfortunately in the previous EXECO meetings, the representative is not the highest official. So it's now the first or the second highest official. We do admit, Your Honor, that legislation is very important. Unfortunately, we're also running out of time, because the investment of the stakeholders of PhilHealth is something that should be protected. We will then look into the possibility of cutting the bureaucracy, because referring it to CAAC, that's simply members of the board of PhilHealth, with an ever-changing composition, without a concurrent stop payment order, will have no teeth. When the issue on fraud was brought out sometime in 2004, mid-2000, I personally submitted a proposal to PhilHealth. It was then Secretary Duque I was fully coordinating with. We had many guidelines in place. Unfortunately, when there was a change in leadership in PhilHealth, all of these guidelines were also changed. I just realized that when we did a review. If I may, Your Honor, an apology is something that is beyond our comprehension, because it is a responsibility to look after the welfare of the other PhilHealth members. May I then propose that you give us, let's say, a timetable of 1 month. We will look into the legal repercussions, into the IRRs that are existing, cut all this bureaucracy, and possibly instill a stop payment order pending investigation. That was the output that we had during the previous investigations, and a repeated recurrence of fraud against PhilHealth does not have a place in our society. May I also take this opportunity to convey, Your Honor, that seeing the reports, most of which have not reached the office of the President of PhilHealth, because it goes through a bureaucracy within the institution. The CORSEC is actually an appointee of the chair of the board. So I will be conferring with our CORSEC, because, again, this should have been stopped at a point wherein it could have been unstoppable. We do admit that there are lapses that we need to correct. We apologize for what happened. We will look into the composition of responsibilities of CAAC, but at the same time, we will see to it that the stop payment order be issued on all facilities that are undergoing investigation. This will allow, Your Honor, the fast tracking of the resolution of pending cases. Because if there's a pending stop order payment, the institution and PhilHealth will be helping each other so that cases will be resolved immediately.
Thank you, Secretary Garin. Ms. Ontiveros Barakel.
Thank you, Your Honor. One thing that, as one of the new board members of PhilHealth, I appreciate about the board, including its composition, is that it's made up of health reform advocates from different sectors. That being the case, Your Honor, based on the records of the CAAC, of which I am the new chairperson, there have been reform efforts introduced by our committee dating back to June 2010. Dating back to the documentation that the good chairman has of the meetings that the committee has held. reforms addressing both the efficiency, including the speed of the processes participated in by CAAC, while looking after due process for the professionals and providers subject of complaints. Reforms, Your Honor, for example, CAAC directed the legal service to provide profiles of healthcare providers whose administrative cases were under appeal. So in this sense, I would like to substantiate what one of my members, Dr. Aiko, said earlier. Further, Your Honor, a second reform would be, for example, that CAAC established procedures or procedural due process on applied cases. Third, Your Honor, CAAC undertook a comprehensive review of all the appealed cases. And as of July 2015, this constitutes the list of 82 cases pending before my committee. And last but not the least, as an example of the reforms CAAC instituted since June 2010, CAAC recommended the use of what we call hybrid rule for pending cases with multiple counts of the same offense. So just to give a brief accounting, Your Honor, in the first meeting which I chaired as the new chairperson of CAAC just this month, July 2015, we disposed of around 20 pending cases, all of them constituting cases of multiple counts of the same offense, so that again I am happy to substantiate that we are right now current in the appealed cases that are before our committee and that we will raise to board. Meaning, Your Honor, we are now, what are pending still with us are cases for the year 2015, Your Honor.
That's what you mean by current, the year 2015?
Yes, Your Honor.
What about these cases now then? Well, anyway, I think the point has been made. And I'm sure Attorney Padilla, Ms. Barakel, Ontiveros Barakel, and Secretary Garin. First of all, I'd like to express my confidence in your capabilities and integrity. Secretary Garin, Attorney Padilla, Ms. Barakel, Ontiveros Barakel. And I'm sure after this presentation, after this hearing, things will start changing. Anyway, Secretary Garin has already stated that they will do the necessary reforms so that this seemingly sorry state of affairs will not continue.
We will continue to sustain the reform efforts, Your Honor. Salamat po.
Okay. Session suspended for a few minutes. Hearing resumed. Okay, I think we have made a point as far as the CAAC is concerned. At the outset, again, let me repeat my my full faith and belief in the capabilities and integrity of Dr. Janet Garin, Secretary Garin, Attorney Alex Padilla, and Ms. Ontiveros Barakel. I'm sure you will proceed with dispatch after this hearing. Let's move on to another topic that is equally as important, yet seems to be not given light. As I said kanina, tatlong pillars ito. Una, yung mga institusyon, mga ospital, mga clinics. Pangalawa, yung mga professionals, yung mga doktor, healthcare providers. At pangatlo, syempre, yung pasyente, yung patients. Today we have an organization called the Philippine Alliance of Patient Organizations, represented by Ms. Fatima Lorenzo. Ms. Lorenzo, please, I understand you have an opening statement. You have the floor.
Thank you, Mr. Chairman. The Philippine Alliance of Patient Organizations, PAPO, the umbrella organization of several patient groups in the Philippines, represents the voices of those who suffer from diseases, disabilities, illnesses, impairments, or syndromes. As a member of the International Alliance of Patient Organizations, AYAPO, we work with communities of patients to get our voices heard by all involved in healthcare. And with the help of our members and collaborating organizations, our work is to advocate for patient-centered healthcare in our country. We laud the Aquino Health Agenda of Universal Healthcare or Kalusugang Pangkalahatan. President Aquino rightly articulated this as, I quote, the provision to every Filipino of the highest possible quality of health care that is accessible, efficient, distributed adequately funding, fairly financed, and appropriately used by an informed and empowered public. We subscribe that the best patient is one who is well informed and empowered, as well as one who takes responsibility for his own health and wellness. At present, the patient's voice is not heard enough in healthcare-related policy making. Among the many stakeholder groups, healthcare professionals, hospitals, the industry, more attention could be given to the long-term users and beneficiaries of health care, the patients themselves, and the organizations that can represent them. The Philippine Alliance of Patient Organizations represents 15 organized patient groups out of the 59 patient organizations mapped in the recent WHO meta study. Many more are out there with very little capacity to organize themselves legally and be recognized because it takes time, skill, and resources. As you can imagine, when one is diagnosed with an illness or a disability, getting in touch with other patients or even caregivers in a similar situation would be the last thing on your mind. But the time is ripe for building cross-sector alliances and working collaboratively with like-minded healthcare professionals, policymakers, academics, researchers, and industry representatives towards patient-centered healthcare. And we at PAPO accept that challenge and are presenting ourselves to be one of the voices of the Filipino patient. This is our position on the current PhilHealth scam. The Philippine Alliance of Patient Organizations deplore the fraudulent PhilHealth claims on cataract surgeries that were unnecessary and anomalous and have caused the violation of the rights of Filipino patients. These doctors exploited not only the system, but the patients in whom they swore to serve, heal, and protect. They should be held accountable for what they have done. In line with this, the patient groups feel that the Ophthalmology Society needs to police its ranks and have the duty to preserve the Hippocratic Oath that all of them swore by. The Philippine Medical Society needs to function with an ethical leadership perspective to preserve the standard and quality of doctors we have. The Philippine Regulatory Commission needs to exercise its mandate to penalize and weed out unethical doctors. Our country is fast on its way in improving transparency and accountability in the Aquino administration. At the same time, the health services have improved to become more inclusive. Proof of this, PhilHealth has greatly increased its coverage through massive enrollment of the poorest quantiles of society. Also, Department of Health, through Secretary Janet Garin, has provided the patients an opportunity to be part of the National Hospital Quality Improvement Program. As PhilHealth strives to expand its services to realize the social protection it is mandated to do, the doctors need to take ownership in deepening care to the least of our countrymen. We appreciate the cataract benefit of PhilHealth. It is something that is a blessing to a number of seniors. However, we are more concerned with the unabated corruption that this will cause if the perpetrators are not brought to justice. There are doctors that will continue to find a game out of the system, no matter how good PhilHealth will become. On the supply side, it may also be good for PhilHealth to review its systems and ensure transparency in its processes. PhilHealth needs to constantly listen to patients in establishing their policies. Cataract operations are very important. They are life essentials. But there are senior illnesses that are more vital, both in individual effects and in relation to the family and the community. In a recent senior wellness program in Camarines Sur, as much as 50% of over 4,000 seniors engaged in 40-plus barangays and 7 municipalities are hypertensive. 26% suffer from painful arthritis and about 10% from diabetes. Only 2% have cataract. In considering statistics, hypertension, arthritis, diabetes, and upper respiratory illnesses need more vital benefits. We believe the DOH and PhilHealth could also provide more incentives for health promotion, disease prevention, and primary health care. Last February 15, in the first Philippine Patients Conference, the patient groups called for new measures on 3 fundamental areas to improve the quality of health care delivered nationwide. And these are anchored on the following principles: respect for the Filipino patients' rights, universal health care for all patients, and patient participation in creating health policies that are measured by substantive performance indicators. In order that patient-centered healthcare becomes a conscious and deliberate agenda, we specifically ask the following. 1. that the Philippine Health Insurance Corporation include at least 2 patient representatives to become members of the PhilHealth Board. While we recognize that the current charter allows representatives from member categories and other government agencies, no one group represents disease-specific groups. Number 2, that the Philippine Charity Sweepstakes Office set up satellite offices in all DOH and LGU hospitals. This is to eliminate the dehumanizing situation where patients have to line up in the wee hours in the morning just to avail of the financial assistance from PCSO. 3, that psychosocial programs be integrated in the healthcare system with full-time, regular personnel dedicated to provide patients with holistic and compassionate treatment. We are cognizant that the medical approach is not the only solution to one's healing, but psychological and social support is equally critical. We feel strongly that our manifesto will have an impact on the quality of health care received by all patients living in the Philippines. We urge you to support our manifesto and become an active supporter of our aims. In closing, we in the Philippine Alliance of Patient Organizations will reach out to more patient groups in the communities and take a more proactive role in giving feedback on the quality of health services using a patient scorecard and social accountability process. In this way, healthcare providers will be aware if they are indeed patient-centric and respecting the Filipino patient's rights. We thank the chairman of the Blue Ribbon Committee for listening to the voice of the Filipino patients. Salamat po.
Okay, thank you. One of the pinaka basic issues dito na nakikita namin kasi yung karapatan ng pasyente doon sa mga nakikita na babasa natin sa internal reports. Yung karapatan ng pasyente hindi sinusunod or hindi binibigyan ng importansya. The basic right to information. In fact, in PhilHealth, one of the IRRs of PhilHealth, it says that the healthcare provider should inform the patient of the status of the doctor who will be attending to them, because it has been alleged that there was one doctor who operated while the doctor that signed the claim was different. Yet hindi na-inform yung pasyente tungkol dun sa status na yon. Maski na sinasabing ko manage yun, hindi pa rin yung karapatan ng pasyente linabag. And again, Papo has, Ms. Lorenzo has given us statistics that only, for example, a sample of Camarines Sur, ang karamihan is hypertension. Ang liit-liit na lang ng porsyento ang cataract. I do remember a presentation by Dr. Padilla also, where she showed that cataract patients are really way down there pagdating sa mga pasyente may sakit, no? Yet pagdating sa claims sa PhilHealth, mukhang napakataas, no? And importante talaga na makinig sa pasyente. In fact, if you read the internal audit reports of the PhilHealth, a lot of it comes from the testimony, yung kwento ng mga pasyente, yung mga nabiktima. At napakahalaga nito. Secretary Garin, Attorney Padilla for PhilHealth, Secretary Garin for Department of Health. Meron ba tayong, hindi kaya sapat na panahon na nabigyan natin ng isang monitoring system din para maumpisahan na yung pagmumonitor ng respecting the rights of patients sa mga hospital, yung karapatan ng pasyente. Tulad sa PhilHealth, di ba, merong allegation na ang lente, kasi di ba pag katarata, tinatanggal yung in-scrape yung mata, tapos naglalagay ng lente. German lens, yung pala, pag-check ni Dr. So, dinala sa PGH, pagtanggal ng lente, Indian lens palang ginamit, the cheapest. Aside from other offenses, but it's clear that the rights of the patient to basic information have been violated. I think it's about time we start a monitoring system and penalizing also those who do not respect patients' rights. Secretary Garin, your thoughts on the matter, ma'am?
Thank you very much, Your Honor. We do welcome the Association of Patients. Indeed, in healthcare, Your Honor, we will not be able to deliver and accomplish our targets without the participation of the public sector, the private sector, as well as the patients. Let me go down to the recommendations. We accept all of this with open arms and open hands. Unfortunately, our hands are tied insofar as the board membership is concerned because it's contained in the PhilHealth law. But this is actually one aspect. I was conferring with President Padilla, Your Honor, and we do believe that if we talk about the membership of the board, it will be to the interest of the general public and for everybody that memberships will not be based on personalities, but will instead be based on organizations. So that the organization, in effect, can have the member of that board will have a bigger voice because the organization that he or she is representing will actually encompass the problems on the ground. But we also have to be wary which organization to recognize. I'm not talking about now, but in the future. And legislation is the best solution to this. The current situation, we actually have one vacant seat in the board. I will make the necessary representations with the President for the possibility of somebody from the patients, somebody who can air out the interest of the patient. And we are looking into the possibility of cutting timelines. If the reason is that some of the defects are in the IRR, Your Honor, we would like to invite you, your office, and members of the Senate. I will be immediately convening a task force to review the IRR because if we don't need to amend the law and we just need to perfect the IRR, then it will be faster. With that, Your Honor, allow me again to express our apologies for some of the events that happened, but we would also like to thank your office and Senate for helping us in allowing PhilHealth to perform more. Let me just take this opportunity because many things has been coming out in the news. Two things, there are allegations, there are counter-allegations, and I was informed that there are now senior citizens complaining that services are not being given. This will trickle to many problems. So I appeal to the healthcare providers and of course to all the stakeholders, the health professionals, the hospital owners, that we have an open door for PhilHealth. You can come, sit down with us and ask us, but precise for me to correct that it is not true that PhilHealth is running out of money. PhilHealth has the exact reserves, but we do agree that fraud should be curbed because if not done at the appropriate time, and this is the opportune time, our obligation to the members of PhilHealth will be put at stake. Let me also clarify that what PhilHealth is paying is not government's money. As an insurance, it's a risk pooling mechanism so that the money of PhilHealth is actually the money of the members of PhilHealth. In other words, it's the money being paid by the private sector for their employees and also the employers. It's also, it actually encompasses a huge bulk of the sin tax revenue, 38 billion, approximately 38 billion out of the sin tax revenue goes to PhilHealth enrollment. So it's not mainly government's money. Similar to other insurance mechanisms of risk pooling, it's actually the money of the stakeholders so that members of PhilHealth actually have a say and have a stake insofar as PhilHealth utilization of funds is concerned. Lastly, allow me to correct the misinformation that because of what is happening, PhilHealth is now failing to provide services to the senior citizens. That is not true. In fact, we have expanded the coverage of dialysis. We will be expanding other programs. And in the coming months, we are just preparing our health facilities. We will have a promotive and preventive healthcare program for all senior citizens and the 14.7 million families under the National Household Targeting System. We will be calling the program as a checkup, as an amended checkup package, and we'll make the appropriate presentation at the appropriate time. Thank you, Your Honor.
Yes. Thank you, Secretary Green. I know wala sa jurisdiction mo ito, pero merong intriguing na suggestion, na intriga din. I just want to get your thoughts. Yung ilagay yung mga PCSO offices, ilagay doon sa loob ng public hospitals natin. Anyway, yung perang hinihingi nila para sa PCSO, pang medicine rin yan eh, panggamot yan, pang doktor eh. Anong tingin mo, Secretary Green?
Sir, we don't have any objections to that. In fact, if it's a government hospital, logistically wise, it will not be that expensive. You don't have to rent a space, and we can actually coin it because we have a public assistance unit or a medical assistance program in most, not all, but most of the government hospitals. So it can be a combination of that office, PCSO, medical assistance, and the public assistance unit.
And lastly, dito sa Bureau of Health Facilities and Services, Regulatory Bureau, may nakalagay dito, Facilities and Services. Pwede na natin ipasok din yung monitoring ng patients' rights? Pwede ba natin or in some other bureau if you want, but can we start a monitoring system of patients' rights so that institutions can also be penalized if they do not take care of patients' rights?
Your Honor, we would look into that closely, but if I may, this is the Bureau being handled by Attorney Nick Lutero, by Director Lutero. They handle licensing. So many of the complaints that are coming into our office are actually being forwarded to them as a regulatory body. What we have instead done was to incorporate patients' rights in the scorecard that we have crafted in terms of hospital subsidy. Our only dilemma is that this affects only government hospitals. We have started the implementation of this for the 72 DOH hospitals, 66 plus of the 72. Patients' rights is, patient health care is actually one of the parameters. What do we mean by this? The allocation of the sin tax revenue will not be historical anymore. Instead of the medical directors, the hospital center chiefs going to my office to ask for an additional health facility enhancement allocation, what we did is to come up with a scorecard duly validated by WHO and the EU. USAID is coming into the implementation. This encompasses first patients' rights, next is PhilHealth utilization, third is availability of medicines and ancillary procedures, fourth is cleanliness and sanitation, and fifth is a health system delivery network. This will be producing a scorecard. That scorecard will now be commensurate to how the sin tax revenue will be divided to all the healthcare facilities. Implementation at the level of the local government unit hospitals will be done by 2016 because of lack of time. This is where we welcome patient participation. But moreover, Your Honor, I would, personally, I'm not speaking in behalf of the department as of the moment. I will be consulting my EXECO members. But on a personal note, I would recommend that patient participation be made fully with the Philippine Healthcare Insurance. Because if we go through the tedious process of validating complaints, looking into the accreditation and all these things, it will really take time. The complaints that has been put forward to some of the facilities that we investigated sometime in 2001, then 2004, are seemingly the same facilities that I am seeing now. So it's with a sad heart that I'm starting to realize that we thought this has been resolved, pero naibalik pala. The possible implementation of a stop payment will actually give PhilHealth the teeth. Because we do admit that some, I'm not referring to all, but the some of the healthcare facilities can better afford lawyers who will give PhilHealth a difficult time. So a mandatory automatic stop payment of facilities having many complaints, let's say a minimum of 2 or 3 cases or even 2 cases, will immediately redound to stop payment, will actually be more penetrating to the hearts and to the pockets of the erring health facilities, rather than going through all the bureaucracy. Thank you, Your Honor.
Well, that idea of the scorecards is certainly very innovative and a breath of fresh air. Congratulations. That's a good idea. I look forward to your being very successful on that. Ms. Ontiveros Barakel.
Thank you, Mr. Chairman. If I may just express support for the statement of Ms. Lorenzo of the Philippine Alliance of Patient Organizations. A brief 2.5-minute part of a statement I had actually prepared for today's hearing, Your Honor. Also, more than ever, we must push to strengthen patients' rights and prevent them from being abused, especially by those who allegedly seek to derive super profits at the expense of public health. Based on the ongoing investigation of alleged erring private healthcare providers engaged in the so-called HACOT system, it would seem that certain patients' rights, such as the right to informed consent, good quality health care, and to choose their physician and or health facility, were widely violated. I believe that by making communities aware of their rights and the government's duties and responsibilities to them, they will not easily fall victim to the allure and deception of unscrupulous groups which are allegedly engaged in HACOT systems in order to file hundreds of millions of pesos worth of questionable claims to the government. The public will need a policy, Your Honor, a policy tool to protect their rights as patients. This must be based on the concept of human rights in patient care and the overall framework of universal health care. This will empower the citizens and broaden the discourse from the limited health consumer, healthcare provider lens to a deeper discussion and institutionalization of basic human rights principles, which, while centered on the people, will also touch on the interaction between the patients and healthcare providers. Lastly, Your Honor, this incident or these incidents must push government to forge better and more transparent partnerships with the private sector. The public sector and the private sector must work together to ensure the welfare of the people and the realization of patients' rights-based universal health care. Maraming po salamat, Mr. Chairman.
Thank you. Attorney Padilla.
Thank you, Your Honors. Your Honor, I think PhilHealth is really moving towards a more member-centric application of its rules and regulations. We feel, Your Honor, that, well, PhilHealth itself, the law itself, actually favored the providers and the doctors when reimbursements are actually made directly to them. No? And if you notice in our current law or current state of affairs, Your Honors, the members actually get the benefits, but not from PhilHealth. Our reimbursements go directly to the providers. No? The fact that we pay the providers now fast, no? Which used to be a complaint. I think a year or more ago, there were complaints that we were delayed in paying the hospitals or other providers and doctors. No? I think we pay them fast now. I think there is no reason for them to complain in that sense. But now, we really have to go member-centric, no? And that's why we have instituted several reforms, Your Honor. For example, if there was a violation of the no-balance billing and the patient particularly was asked to pay for certain services, we now have a policy of charge to future claims, whereby the patient who is made to pay more than what was necessary, we will now collect from the provider at twice the amount. We have also instituted our dissemination and information campaigns, particularly with the poor. We have the Alaga Ka or Alamin at Gamitin campaigns for the 14.7 million that the Secretary of Health was talking about, and which is being financed also by government in terms of premium contributions. So, and we will be coming out in, again, conjunction with the Department of Health with a promotive and preventive care. No? I think we recognize, both the department and PhilHealth recognizes that preventive care is still the best way, rather than the more expensive curative phase. No? As they say, an ounce of prevention is always worth a pound of cure. And we are moving in that direction, Your Honors. And we are particularly sensitive to patients' rights. For example, on the matter of informed consent. It has been sometimes the practice of some providers of merely making the patient sign that they were informed, and these are prepared or prepared forms, no, which I don't think the patient actually reads, but he is nonetheless made to sign it. No? Part of the ethic, part of the, I think, the meaning of informed consent is that the patient must be able to really understand what is happening to him or the procedures that will be given to him in his own words. So that stuck to my mind because this is part of the ethics of PMA, that when you talk about informed consent, the doctor is supposed to be talking to the patient and then explaining to the patient what will be done and asking the patient to explain in his own words what he understood from the doctor. If that were the case, Your Honor, then that would really be an informed consent. Because as I testified earlier also, even in my particular case, I was also a patient once. I'm a lawyer and educated, etc. But as I said, with complete trust and confidence with the doctors, I will do anything that the doctor tells me to do, knowing that only the doctor is good at the expertise that he is having, and that he should know what should properly be applied to the patient. No, so that is how much faith and confidence patients have with doctors, and that is why it particularly hurts PhilHealth when you hear providers actually violating patients' rights. No, to us, the PhilHealth reimbursement is actually intended for the patient, but we only pay it to the providers. No, maybe also some legislation may be made in that direction, Your Honors, that we can correct. Part of the legislative proposals that we will be making in due time, Your Honor, is in effect also to try and provide for a fund for patients whose rights are violated, because they will require even bigger expense as far as medical care is concerned, which we intend to get from the providers as penalties, no? And maybe constituting a trust fund that will be left for the patients to actually dip their fingers into, because PhilHealth will have no fund as far as that is concerned. But in terms of fines and penalties, it could be done with the proper legislation, Your Honors. Thank you.
Sa ngayon, wala pa yun. Ano?
Wala pa ho.
Well, it's certainly very innovative.
Parang indemnity fund.
Ganda ng idea na yun, Attorney Padilla. Ms. Lorenzo?
We thank you, Attorney Padilla, for that information, and we will look forward to the innovations and recommendations of PhilHealth to the legislation. And maybe to push it a little further, maybe we should also focus on patient safety, reporting of adverse reactions of medicines, of operations to the patient, because right now, some hospitals do not report adverse reactions for fear of losing their license, I guess, or maybe getting a lower score in accreditation. So I think I was part of the first ASEAN Patient Safety Congress, and there was a push already to really institutionalize patient safety, because human error will occur, definitely. Because one, there are just too many patients in relation to a doctor or to a nurse. So human error is there, and that is a fact. But when it does happen, then it has to be reported. and certain measures have to be done to address these adverse reactions. So this is one whole discussion, Your Honor, and maybe it's something that PhilHealth and DOH must also look into in the interest of the patients.
Yes, Attorney Padilla.
Your Honor, I'm in complete agreement with the adverse reaction. It's now a practice that has practically been forgotten in many hospitals. The practice goes, Your Honor, is that every patient that goes through the processes of the hospital, there may be good or bad effects, no? But this is recorded, and then it is spread or informed to the other hospitals in order to prevent any future repeat, no, of that, no. One of the biggest objections then that I heard was that it violated the confidentiality of the patient, no? But that is a wrong argument again, Your Honor, because you could very easily remove actually the patient's name and just deal with the actual incident which caused the bad effect, no? And still, it will give good instructions for future doctors or other hospitals to avoid it. So it was a good practice, and it should be a continuing practice to this day, no, in adverse reaction.
Okay, yes. Thank you very much. Okay. I was going to say that the hour is late, and look.
Thank you, Your Honor, for giving me the chance. First of all, in behalf of the Quezon City Eye Center, we fully support what the DOH is doing, what PhilHealth is doing, and we fully support Ms. Lorenzo and the patient's organization. And we know that everything will be we will be in a better position. And I would like to thank everyone. Now, I do have a couple of concerns. It's being downplayed. The DOH in 2000 started a national blindness prevention program, and they targeted for the year age in 2004 started a national blindness prevention program, and they targeted for the year 2010 to have surgery rate of 2,005. Means that by 20 we should 250,000 cataract surgeries per year. Information, Senate, sir. We only did a total of 98,000 cataract surgeries. We are so far below. World only did it also. It stated cataract. We are so far in the data is 1,000 per million. Assuming that per million, we are 100 million Filipinos. That means there are Dr. Mangita. If the target of as Dr. Mangita has stated in the past in the second Senate hearing, addressing the backlog, Your Honor. That is, and according to the WHO also, their minimum suggested cataract surgery rate for the poorest developing nation is 2,000, meaning that's 200,000 cataract surgeries for a population of 100 million. I'm just pointing this out, Your Honor, because it seems that the lack of data in this particular disease is leading us to false assumptions, or it's misleading us into certain behavior towards, for example, increase in cataract surgeries, for example. That is one concern, Your Honor. And of course, my second concern, and I fully support the stop payment as a measure to prevent further bleeding in terms of it's an effective measure. We know our payments have been stopped, so we know it's effective. But we do ask if it's possible, Your Honor, if the Because if we are found to be innocent in the end, but if the end came like 1.5 years later or 2 years later, then the stop payment would be effective until that time, and a stop payment of that length would necessarily spell the doom of the eye center as well. I'm just my two concerns, Your Honor. Thank you.
Your Honor, if I
Secretary
may.
Garin.
Yeah. Apologies. I just met Dr. Evangelista. We didn't know each other since before. Okay. But let me go to the dilemma that it might cause the closure of the eye centers. Similar to what we are doing now with FDA, we're giving timelines. So meron ng, o dapat pagka nag-apply ka within this period of time, natapos siya. It's either you approve it or you deny it, as long as decision is made at this point of time. We will rest assured that I will personally oversee implementation of such in PhilHealth. So pending cases should be immediately resolved. That's why I'm now texting my people to get hold of the IRR, because what I'm looking into is a possibility that many things were inserted into the IRR in contrast to how the PhilHealth law was actually conceptualized. I was the principal author of this law during my second term in Congress, and I'm now being given information that this is because of the IRR. And we will have to look into that, because you know, Your Honor, and you have been my mentor in telling me that the IRR should not contain anything that is not within the law, because we cannot just make laws in the IRR if it was not included in the crafting of the law. So we assure the other stakeholders, of course, or other partners in healthcare, that timelines will be given to PhilHealth insofar as resolution of cases is concerned. Now, I will also look deeper and closely into the into the claim that DOH has come up with the figures of at least 2,500 cataract operations per million population. I will closely look into that, and similar to the other programs of the Department of Health that we have been reviewing, we have more or less been successful in reviewing already 80 to 85%. Maybe we have missed this aspect. But precise for me to say that in the department, we do not give quotas in concerned cases. And even in the World Health Organization, I've been working closely with them. I'll inquire from the regional office. But my personal knowledge has pointed to many programs wherein quotas, especially medical procedures, are not actually allowed. What we have in the department is usually like, okay, attaining a cure rate of this percentage, but that will always boil down to incidence. Let's say if you talk about tuberculosis, we have to have like TB-free municipalities, or malaria-free, schistosomiasis-free, leishmania. It's basically making that community free from that infectious disease. And we have one of our very good new undersecretaries, Yusek Belisario, handling this program. So I will be conferring with him if indeed there is a minimum of 2,500 cataract operations being recommended per million. But as a medical doctor, usually we don't deal on quotas and data.
If I might correct, it's not a quota.
Wait to be recognized.
May I be recognized, Your Honor?
Dr. Padilla
yes.
first.
First of all, I'd like to correct the data. I did not say 78,000. I said there were 180,000 blind estimated. The last survey of blindness was done in 2002. That is 13 years ago. It was also brought to our attention that the statistics being in the DOH website are erroneous. They are bloated statistics for cataract, because they did not take into account that the doctors have been doing more and more cataract surgeries every year. Then if you actually study the incidence of blindness in the Philippines from 1997, then the 2000, first 1980s, then in 1997, then in 2002, it has been going down dramatically. But this is not being talked about even internationally, and this is actually unfair to the Department of Health and to the eye doctors who have been doing so many cataract surgeries, to the point that many people are 20/20 and they're still doing the cataract surgeries. The point is, I don't want, as the Secretary Garin said, we don't usually say, you must do this many per year. It is not really, I don't know who propagated that. In fact, we are in the process of reviewing a lot of AOs that were issued. But I think the point we have to stress is, in that 180,000 and in new AOs that they're trying to come up with, they have to define who are the blind and who really need the surgery. Because everybody after the age of 60 will have some degree of cataract, but they are not bothered. So are we now supposed to get them all and operate on them and waste PhilHealth funds? These are questions. These are questions we have to address as part of public health. This is public funds. As our advocate said, for patients, we have other life-threatening diseases which we need to address. Now, that having been said, we have cataract blindness. It is supposedly still number one. Now, to answer all these doubts, the Department of Health has just agreed to fund another survey of blindness by the Philippine Eye Research Institute. Again, the last survey was 2002. So everybody who quotes statistics is really just guessing. So we cannot argue based on guesswork. But the fact of the matter remains that what we are also against is the irresponsible use. It's the HACOT system where many patients don't even know what's being done to them. It is the multiple procedures once patients are admitted. It's all of these things put together. But we cannot concentrate on numbers alone. Because as doctors, numbers alone is not really the issue, not so much the issue. Again, Your Honor, I don't want to delve into numbers which we can argue and argue ad infinitum, and we will never get to the bottom of it because there is no survey since 2002. And we are like 101 million, but I gave some data to the Senate last time based on the Philippine Eye Research Institute, which is the official research arm of the Department of Health. And the values there are much lower than what's in the website of the Department of Health. So now we are in the process of investigating why that is so. Why? So what is the reason? So we are still, again, investigating with Yusek Belisario as well. Thank you, Your Honor.
Yes. I'd just like to comment first that I think Dr. Belisario is very capable.
Yes.
So I'd like to congratulate the Secretary for recruiting him. So anyway, Dr. Goseng Fiao, I see that you want to say something.
Yes, Your Honor. Actually, I've been really, I fully support naman what the DOH is doing because, and the PhilHealth is doing because, admittedly, there is a limited amount of funds. No, and I've been wondering what is it that Dr. Menggita has been saying about the unnecessary cataract surgeries. No, and then she pointed out that it's the 2020, the people who can still, they're not complaining, and then they're operated on. No, and it dawned upon me while I was doing my own research the past few weeks that the issue really is that the cutoffs are different. No, the DOH and the WHO put their cutoffs at 2070 for visual impairment, and for blindness at 2400. No, so malayo yun. But the PAO recommendation is 2040 ang cutoff, and you can even do it at better than 2040 if there is another indication like glare and stuff like that. No, so there lies the discrepancy.
By cutoff, you mean that when you reach that boundary, then dapat
it becomes
operahan
medically
ka na.
It becomes medically indicated. No, so yun yung difference, sir. Na the indication for medically indicated that PhilHealth is using is not the same as what Dr. Menggita is pointing out. Perhaps that is the one area that we should really look at. No? There should be maybe consonance in the policy, no? So that we can avoid this kind of a situation where doctors are being accused of unnecessary surgery when the policy of PhilHealth says 2040 pwede, and then the DOH says 2070 or 2400 dapat. No, and that makes more sense actually if we increase the cutoff, because what the new circular says, if I can recall, no, is that we limit the number of surgeries per doctor to 50 per month, diba? And then a lot of my colleagues are already complaining. What about the 51st patient, the 52nd patient? No, what will happen to them? Like for example, if I have, it's limited to 10 patients per week. No, if I have 10 per day, if I have 10 paying patients and then one PhilHealth only no balance billing patient, edi I will schedule the 10 first. What if the following day ganun na naman, no? Then I'll just keep scheduling the paying patients before the no balance billing patients, no? But I understand that it's a stopgap measure, no? So it's something that we really needed to do to control the situation and stop the bleeding. But I think the better solution would be to change the cutoffs, no? Make it consonant with the goals of PhilHealth and the goals of DOH. I think that's where it starts.
Your Honor.
Secretary Garin.
Yeah, I would like to thank our good resource person for the comments. On the issue of there's no meeting of the ends in terms of if it's the vision of 2020, ganun ba? We will look into that. No, precise for me to say that in healthcare, I don't know. Let me review if there are previous circulars to this effect in the Department of Health. But as far as I'm concerned, we really do not meddle as to the Department of Health should not meddle in the individual unless it's patient safety that's concerned, because we cannot, similar to what I was conferring with PhilHealth when I assumed as acting secretary, we cannot dictate on a surgeon to do these things if his way of operating in a patient is this way. This is something that should be discussed, and what PhilHealth has been doing for the past few months was actually inviting societies, patients, other stakeholders, healthcare facilities, so that they get to give a voice in the crafting of packages. So we will invite all the stakeholders through representatives, not individually, because in the crafting of packages, in the amendments that needs to be done, everyone should be heard. But conferring with President Padilla, I believe what PhilHealth is trying to curb is the fact that there are already many seekers going around. Alam nyo yung pagkawala ka namang sakit, pero sasabihan ka, ay may libre ditong operasyon, yung po ang, it's actually similar, Your Honor, to false advertisements. Like, let's say, if somebody claims that this is a cure-all, or if somebody will say, you know, if you go into stem cell, then pwede kang bumata, or hindi ka or stem cell cures diabetes, cures gout, cures other chronic conditions. These are without scientific basis. At hindi po pwede yun. There's actually no cure-all, because as what President Padilla was saying earlier, many of the patients would rely 100% on what the doctor says. It's like even the lawyers would rely on what the doctor says, because just similar to the doctors, when you get advices from lawyers, you follow immediately, and then the repercussion will actually be on the doctor. So ganun po ang nangyayari. But what we are pointing out is the fact, if I'm very much familiar with the situation of the Our Lady of Perpetual Help Hospital, Our Lady of Mercy Hospital, this is a hospital in Bacolod, but the patients were coming all the way from Antique, Iloilo, and then they go back to us in the government hospitals and the private patients, blind. And they cannot avail of their PhilHealth anymore because it has been exhausted. So that is what we are trying to prevent. Like, if the patient does not seek consult, it possibly means he or she is not feeling anything. But on the other hand, if we talk about preventive and promotive healthcare, we should focus more on advocacies. Like, we can go out and tell people, like, you know, blindness can be prevented. The following symptoms warrant a regular consultation. But having seekers in between can possibly distort healthcare. Of course, we would like to sit down with you in another forum you're all welcome to come to my office. Then we will take the pool. And I think, Your Honor, the WHO has been giving us a lot of technical consultancies that's actually been paid by the Philippine government. So we will incorporate and include this aspect so that a confluence of ideas, guidelines will be in place. Allow me to repeat that we are not pushing for personalities, if I may. I know I was not really part of the initial investigation, but having read through this morning on the events that transpired, maybe allow me to appeal as Secretary of Health that we now elevate this matter and don't look at personalities, but instead focus on what were the systems, what are the lapses, what were the foras that were probably missed, involving everybody so that our target will be a better system, a better health care, commensurate to what the people deserves. Thank you, Your Honor.
Thank you very much. Okay. We still have things to take up, but the hour is late. We will just invite. Those for the next hearing. We will invite. We will inform you that you are invited. So until further notice, these hearings are hereby suspended. Thank you.